Hello and welcome. Thank you for joining the 15-minute webinar session on the new OmniLok cervical seal, which has been designed to reduce fluid loss during hysteroscopic procedures. For those that don't know me already, my name is Gemma Hickman, and I'm a surgical sales representative for the east of the UK. So our agenda for today will be to give an overview of the new OmniLok. I will give a short technical demonstration, and we'll talk about hysteroscopes that you can use the OmniLok with, have a look at the patients that would benefit from an OmniLok, and then I'm going to give you a sneak peek into the future of fluid management. There will be a short Q&A at the end of the session, so if you would like to send us questions throughout the presentation, you can do so in the following ways. If you're watching on your phone or iPad, all you have to do is tap your screen and you'll see 3 dots. Tap the dots and you will see the screen shown in the middle here. Just click on the Q&A button there and type in your question. If you're viewing through a laptop or computer, then just click on the Q&A at the top right-hand side of your screen and type in your message. We'll aim to answer all the questions at the end during the live Q&A session. Your Hologic team are still working, so if you do need any further support or questions, you can get in touch with your local representative or email us at the below ukgynecervical@hologic.com. So for some context, let's review the current COVID and NICE guidelines. So for COVID, this really suggests avoiding multiple passes through the cervix with your hysteroscope, and favouring fast and effective procedures. Also, the avoidance of aerosol generating procedures, including general anaesthetic where possible. So moving as many procedures as you can to the outpatient setting also avoids hospital admissions and further risks to your patients contracting COVID. This is a snapshot of NICE guidelines, which really looks at encouraging the organisation of your services to progress from see to treat in a single setting. So what is OmniLok? Hopefully I can show you how OmniLok ties in nicely with these guidelines and helps you to get it right first time. So essentially it is a simple device that's going to make a big difference to some of your more challenging cases. It does this by creating a gentle seal against the cervix with this graduated silicone tip. This white section in the middle contains a spring to maintain a constant tension against the external os. And this extendable collar at the end is available for when you need a little bit of extra length. We've all been in those cases where fluid is leaking out of the cervix, it's going all over the floor, the nursing team are rushing around trying to hang more and more fluid, and you're clamping the cervix with more tenaculums than you can hold. So it's these sorts of cases where the OmniLok really comes into its own. The cervical seal improves your distension and therefore your visibility, improves your patient experience, procedure is quicker, the silicone plug is a lot kinder to the cervix, and improves your efficiency, not only throughout the procedure, but reduces the risk of having to bring her back a second time to complete any unfinished. So this really does support you in getting it right first time. So how does the OmniLok work? I'm going to show you just how simple it is in 3 easy steps to set, seal, and see and treat. So firstly, you would slide your OmniLok on top of your operative hysteroscope, setting it in place, advance to the cervix to create the seal, and continue with your see and treat procedure as per usual. So now I'm going to give you a short technical demonstration to show you exactly how to slot it onto your hysteroscope. Hopefully you can all see me. So this is what your packaging looks like. It will come in a single-use sterile packaging, and then out of the packet would look like this. So this end here is your silicone tip that will fit snugly in the cervix. The middle section is the white spring-loaded area, enabling free movement whilst maintaining tension against the cervix. And this end here is the extendable collar. So if you need a bit of extra length, you can extend it by opening with the blue tab or retracting back. And I'll show you how to do that on the scope. So in the end here, you'll see there's a little hole that you insert your hysteroscope. Angle the hysteroscope to allow for a smooth insertion and set it in place. Then you would advance to the cervix, and you can see here how it would maintain that tension throughout your procedure. If you do want to use the extended formation, the hand that holds your hysteroscope, you would put your index finger on the white tab underneath and use your top hand to extend with the blue tab. And then if you did want to retract it again, just pull back on that. So when you're finished with the procedure, you would just slide it off the scope and dispose of in your clinical waste. So you can see on my demonstration, I was demonstrating it on one of our new Omni 3-in-1 hysteroscopes, but it was designed, with the MyoSure hysteroscope, the standard ones, and this Omni hysteroscope in mind. So that would incorporate the diameters from 5.5 on the smaller operative sheath up to 7.25 on your MyoSure standard XL scope. So just bearing in mind, actually with this one, I have heard from my Canadian colleagues, it's been out a little while longer in Canada, and I have heard that there are some people that are using it with smaller diameters. Just be aware it wouldn't fit quite so snugly, but if it provides benefit, then absolutely fantastic. So be aware that if you are using it with the original MyoSure XL hysteroscope, which is 7.25 millimeters, you would just need to chop off the first rung with some sterile scissors, and then it's good to go. So now we're going to have a look at some of the patients that would really benefit from using the OmniLok. So here, those would include patients who have quite large pathology, particularly if it's prolapsing, very patulous or overdilated cervix, and really any cavities where you struggle to maintain distension and therefore your visibility. Other applications could include previous cervical surgery and retained products of conception. So I'd really encourage you to have a look at this website, gynesurgicalsolutions.com. It's got some nice little animations in there. It's got a bit more information on the product, the OmniLok, but also it does have some information on NovaSure and MyoSure as well. So it's quite a good resource. So by now, I hope I've convinced you that this would be a really good product to have on your shelf for when those challenging cases do arise. So here's what it would look like on your shelf. Comes in a pack of 5, has a long shelf life. Your order code is OLK-100, and you can contact your local representative for pricing information. If you don't know who that is, I'll pop up the email address again at the end. You can drop us an email there and we'll put you in touch with them. So here we have Mr. Uys and his team at Sandwell Hospital, and they were one of the first hospitals in the UK to order their box of OmniLok. And the reasons behind this is really just to ensure that those challenging cases run smoothly, make sure that they can be completed. They want to ensure that their busy clinic runs to time, and with less cleanup, hopefully keep the nursing team happy too. So by now you've got a bit of information on the OmniLok, but it's my absolute pleasure to introduce the future of fluid management in your hysteroscopic procedures. So the majority of our customers will be familiar with the Aqualex shown here, which is the gold standard currently, but due to be launched next year is the Fluent fluid management system. This has really been designed from the ground upwards, working in collaboration with nurses and consultants to introduce a really efficient fluid management system. So with the Aqualex, there are quite a few components you need from various companies, some training element, whereas the great thing with Fluent, you get everything in one box, which you can see at the bottom right-hand side of your screen. So from a simplicity point of view, you have an intuitive touch screen. So this would mean that nurses who have never seen the setup before could come in with a step-by-step instructions, and they'd be able to set it up and run the machine throughout the procedure. And it's got very easily color-coded snap-in flow pack cartridges. From a technology point of view, there's some improvements here as well. So you have a dual peristaltic action, which means you'll have far better control over the fluid going into your patient as well as out of your patient. And regarding workflow, it's simpler, it's really efficient, and your nursing team are going to love it. So by now, I think we should have received some questions about the OmniLok, and Alan's been working in the background to collate them all. So he's got some questions for us.
Hello, everybody. Yeah, thanks, Gemma. Great presentation. You've had a few questions have come in while you've been presenting, and the first one is, can I use OmniLok with other hysteroscopes? Now, I know you've touched on this earlier, but just going to go through it again in case people have joined a little bit later.
Yeah, absolutely. Yeah, so it has been designed for use with the Omni 3-in-1 hysteroscopes that I know a lot of you are using to transition from diagnostic to treatment efficiently. You can also use it with the MyoSure scopes and other competitive scopes as well. So it has been designed for that range. But as I say, I've heard anecdotally that some people are using, say 4mm scopes, and as long as you're sort of getting that protection from the fluid coming back, then fantastic.
Great, thank you. Another one is, can OmniLok be used with NovaSure?
Okay, so it hasn't been formally tested for use with NovaSure, so that one would be off-label.
So it's a no, technically.
Not really, no.
It's a no. Is OmniLok latex-free?
Good question. Yes, 100% latex-free.
Okay, very good. And the final one is, do you have to twist the tip into the cervix to create the seal?
Sort of like a lure lock, I suppose. No, so it's graduated. You have got you've got little ridges there, which just helps you to create the seal. So you would just advance it to the cervix here, and it's really the spring-loaded mechanism that ensures there's a constant tension.
Okay, that is all the questions that have come through, so thanks for answering them. If you want to close the session, that'd be great.
Okay, thank you very much. I'll just pop up on the screen the email address in case anyone wants to get in touch with us. If we haven't answered your questions or you suddenly think of anything else, then absolutely drop us an email at ukgynesurgical@hologic.com. And if you did want to find out a bit more information, then do go onto that website, gynesurgicalsolutions.com. Thank you very much for joining us today. I'm sure I'll see you soon.